Here we are treating with Sculptra, and for this patient I am utilizing a cannula. So this is not a needle. A cannula is very similar to a straw in that it's blunt on the end. It is not sharp like a needle. So in order to get the cannula up under the skin, we have to create an opening. So that's what I'm doing here. I'm creating what's called a pilot hole with a little bit larger gauge needle than the cannula, and then I'll thread the cannula through this hole and into the desired areas of treatment. So with Sculptra, we are focusing on staying in the SMAS layer. We don't want to be too deep, and we definitely don't want to be too superficial with this product. It is completely different than your hyaluronic acid based products. So she's not going to have an instant result from this procedure. Now, right when we're done, she will look as if she has an instant result, being that she'll be a little bit filled out, she'll look a little lifted, but that is because this product is diluted with a good bit of sterile water. And so that's exactly what you're seeing, is just the fluid that's there. Over the course of the next 2 to 3 days, her body will reabsorb that, and then the particles of the Sculptra will be left behind. And that's what's going to start stimulating the collagen and elastin for her true and accurate results, which will start to be seen at around 6 to 8 weeks after the procedure. Typically, it does take subsequent treatments to get the best results. Rule of thumb is 1 vial per 10 years of collagen and elastin stimulation needed. So I have recommended that she be treated 3 sessions of Sculptra, and then we'll maintenance annually. It has been shown in studies that Sculptra can continue up to the 24-month mark, if not further than that, for producing and stimulating collagen and elastin. They ended the studies at 24 months, and the samples did show that collagen and elastin were still being stimulated and produced. So the results from your Sculptra can go long past 24 months, which is a huge plus. So Sculptra is going to be mainly for lifting and smoothing of the skin as well, because of that collagen production. It's a very more, I guess you'd say, natural procedure for this, instead of using hyaluronic acid based fillers that don't do as much for collagen and elastin production. Some of my patients still like to be treated with hyaluronic acid based products too, for more of an instant effect. But I highly recommend Sculptra on all of my patients, typically about mid-30s to 40s, just because we need to have that collagen and elastin production and stimulation for overall effects in the tissue, the skin, all of the benefits that are behind it. Now, Sculptra does come with a little bit different post-care than your hyaluronic acid-based fillers. So it is imperative that you massage the areas that are treated for 5 minutes, 5 times a day for 5 days post-injection. The reason this is so imperative is that we want the actual particles to stay spread throughout the tissue and not conglomerate, because if they do conglomerate, this is putting you at a high risk of a granuloma. And if a granuloma is formed, they are very difficult, if not practically impossible, to get rid of. So making sure that you're massaging these areas post-treatment is so important. I absolutely love Sculptra. I love what it does just for overall skin benefits, as well as lifting and providing some subtle volume. But as you can see here, I treated her temple, and now I'm working in her mid-face, her cheek area. She had a few main concerns, 4 more accordion lines to the lower mid-face. However, we needed to get her a little lift to actually help to lift and pull that back up a little bit. You'll see here shortly that I actually do go into the area of concern as well. But I'm just spreading this product right out where I placed it and going ahead and doing her first massage for her. And at the end of the video, I'll do the total face massage of everywhere that I've treated. But you can treat a whole face. You can actually just focus on key areas if you need to. Sculptra is also used in body, so the non-surgical BBLs that are being performed are typically done with Sculptra and or a combination of hyperdilute Radiesse. But Sculptra all around is really a fantastic product if you're a candidate for it. Be sure to ask your injector, get all the details, make sure that you're a true candidate for it, and again, I highly recommend it. But any questions, feel free to message me. As always, if you would like and subscribe, I would greatly appreciate it. And continue watching this treatment, and have a wonderful and blessed afternoon.